The Secretariat of OAFLAD is happy to put this together for your excellencies as you're really busy in your respective countries, especially at this juncture in the global pandemic. Kindly let me introduce you to our moderator for today, Miss Natalie Muyapenda. She is Chief Executive Officer at Kepler, Rwanda. We're honored for her to be able to grace this occasion for us. Natalie, I will pass the baton on to you. Please take it away.
Thank you, Mamia. I just wanted to mention to everyone who's joined us that we have translation. If you look at the bottom of your screen, you'll see a little globe that says interpretation. If you click on there, there is interpretation available in French, English, and Portuguese as we're changing into different languages. So I thank you so much for joining us. I wanted to mention that we will be discussing various items. Last night I looked at the current COVID-19 infection rate on the continent, and we are already above 700,021 cases with over 1,500 deaths. Starting in mid-March, Africa led the way in quick, decisive response, most countries closing borders and enforcing lockdown. But we are seeing an uptick in cases, particularly in South Africa, as many countries open up. Beyond the direct impact of COVID-19 on health systems, as we will hear from the excellencies, the First Ladies, the pandemic has also affected the response to HIV, TB, malaria, as well as the ambition for achieving the universal health coverage, a topic that is dear to OAFLAD. For the next hour or so, we will hear firsthand the impact of COVID-19 from excellencies, the First Ladies of Zimbabwe, Botswana, the DRC, and Niger. We will also hear from Ambassador Catherine Mwangi, Kenyan Ambassador to Ethiopia, Djibouti, the African Union, IGAD, and UNECA, Dr. John Kenkasong, Director of the Africa CDC, Dr. Rupa Dutt, CEO of Women in Global Health, and Ms. Yassine Jibo, Executive Director of Speak Up Africa. Before I call upon Her Excellency Madame Auxilia Mnangagwa, First Lady of the Republic of Zimbabwe, to give her opening remarks, she's also OAFLAD Vice President. I would like to also acknowledge the presence of the following First Ladies who have also joined us. Her Excellency Dr. Ana Dias Lourenço, First Lady of the Republic of Angola, Son Excellence Madame Brigitte Odera, Première Dame de la République Centrafricaine, Her Excellency Dr. Isora Nyusi, First Lady of the Republic of Mozambique, Her Excellency Mrs. Monica Gengos, First Lady of the Republic of Namibia, Her Excellency Mrs. Fatoumata Barrow, First Lady of the Republic of Gambia. I would also like to acknowledge the technical advisors of the First Ladies of Burundi, Comoros, Equatorial Guinea, Ghana, Kenya, Malawi, Nigeria, and Uganda, and the over 45 partners who have signed up and have joined us today. So let me thank you. And to start us off, I would like to welcome Her Excellency Madame Auxilia Mnangagwa, First Lady of the Republic of Zimbabwe and OAFLAD Vice President, to start us off with opening remarks.
Good morning, good afternoon, and good evening to you all, depending on which part of the world you are in. It is an honor and a privilege to welcome you all to this webinar, one in a series of many to come that will be organized through the Organization of African First Ladies for Development, OAFLAD. Allow me to thank the President of OAFLAD, Her Excellency Madame Antoinette Sassou Nguesso, the First Lady of the Republic of Congo-Brazzaville, for graciously giving me this opportunity to chair the very first webinar, whose theme is the health and socioeconomic impacts of COVID-19 on achieving universal health coverage. We are grateful to this Global Fund for collaborating with OAFLAD in hosting this first webinar. Such partnerships make it possible for us as mothers of our nations to share ideas and plan how best we can positively contribute to the fight against this global COVID-19 pandemic. How pleasant it would have been if we were meeting face to face and talking to each other in person, were it not for this COVID-19 pandemic. Using this online platform is the next best thing, as we can still talk and see each other online. My dear sisters, you are aware that we have our own strategy as OAFLAD covering the years 2019 to 2023. We have crafted our own respective country strategies as First Ladies to guide us as we support government efforts towards achieving universal health coverage as per the Sustainable Development Goals, SDGs. With the unwelcome presence of COVID-19 on the African continent, and indeed around the globe, all of us have been working hard to champion response efforts within our communities to mitigate against the negative consequences of this global COVID-19 pandemic. Our communities have been hit hard by this pandemic. In all emergencies, adolescent girls, women, and children, and those most vulnerable are hit the hardest, mostly the elderly, the poor, and people with disabilities. I have seen how provision of essential health services for the population at large have been disrupted, even more so for women and girls. Services for antenatal care, labor, and delivery have been disrupted. People with chronic conditions such as diabetes, hypertension, and heart diseases are failing to access treatment, while gender-based violence is on the rise due to the lockdown measures in place. Our communities are experiencing economic hardships. Companies have witnessed decline in production levels, and some people have lost their jobs. My dear sisters, the Global Fund is supporting our countries to fight AIDS, TB, and malaria. More recently, the Global Fund has availed funding to fight COVID-19. We are concerned about how the COVID-19 pandemic has negatively impacted the tremendous achievements made on the African continent in tackling these three diseases. And now we must double our efforts to tackle COVID-19. I welcome the solidarity that has been demonstrated by Her Excellency, the First Lady of the People's Republic of China, Madame Peng Luan, who has donated materials to mitigate against the impact of COVID-19 to each of the African countries through OAFLAD. I would like to convey our sincere gratitude for this generous donation. Let me recognize other funding agencies and partners on the call. I wish I could mention each one of them by name, but time is not on our side. Thank you so much for your generosity in supporting the work we do as OAFLAD. Today, we have an excellent panel of First Ladies representing West Africa, East Africa, Central Africa, and Southern Africa. They will share with us how they have responded to the COVID-19 pandemic in each of their respective countries. We all have something to share, but not all of us will be able to do so today due to time constraints. However, OAFLAD Secretariat reassures me that there will be more opportunities for all to share experiences in future webinars. My beloved sisters, government officials, and our dear partners, I wish to acknowledge the work of the OAFLAD Secretariat and that of our collaborating partners in bringing us together through this virtual platform. Let us share our collective experiences as we contribute to national efforts to tackle this dreadful pandemic. I wish us all fruitful deliberations. I now call upon our moderator, Natalie Myampenda, to take over the proceedings of this meeting. I thank you.
Thank you, Your Excellency. Before we jump into the discussion, I wanted to mention that we will be viewing a video sent by Mr. Peter Sands, who is the Executive Director of the Global Fund to fight AIDS, tuberculosis, and malaria. As we know, the Global Fund has been working to respond to the crises of HIV, TB, and malaria, and to cut deaths by nearly half. Since the peak of the epidemics. So the Global Fund has put out a call to action, cautioning us that COVID-19 might take away resources to the fight against HIV, TB, and malaria. And so we're going to hear from him in the next few minutes as he talks about the way that they're going to be working to safeguard gains through a video message. Can we have that video message launched?
Thank you to the First Lady of Zimbabwe and to all the First Ladies of OAFLA for giving me this opportunity to speak, and also to the distinguished guests and panelists. For all of us who are concerned about the objective of achieving universal health coverage in Africa, COVID-19 represents a profound challenge. Not only will COVID-19 cause death and suffering itself, but it will have a massive knock-on impact. We anticipate disruption to services for HIV, for tuberculosis, for malaria, as well as for other areas like maternal health or immunization. Indeed, in some parts of the continent, the knock-on impact of COVID-19 could be greater than the direct impact of the new virus itself. So when you think about the commitment, the objective of a health system that reaches everybody, provides health and well-being to all, this is a daunting prospect. And what it means is we need to redouble our commitment. We cannot flinch from the determination to make this happen. From a resourcing point of view, we will need more money. The Global Fund has already made up to $1 billion available in addition to existing grant funds to support countries in adapting their HIV, TB, and malaria programs, and also to respond to COVID-19 itself. But we reckon far more is needed. We published a report recently on mitigating the impact of COVID-19 on countries affected by HIV, TB, and malaria. And we estimated that these countries, above all in Africa, need $28.5 billion just on the medical response to COVID-19 itself, and on mitigating the impact on HIV, TB, and malaria, and on strengthening health systems, and on protecting health workers. $28.5 billion over the next 12 months. And we reckon that the Global Fund needed an additional $5 billion as part of that to play its part in supporting countries in making that response. But it's not just going to be, as you know well, about external assistance. It's also about the policies, the resources, the actions that your countries take themselves. We've talked before about the impact of out-of-pocket payments on the universality, the reach, the accessibility of health systems. COVID-19 is just going to make out-of-pocket payments even more of a barrier, given the economic impact on people's livelihoods. And when you've got an infectious disease, you need them to get that treatment. You don't want them prevented from getting treatment or tests because they haven't got the money. So while none of us have any illusions about the fiscal challenges that governments are going to be facing, this is a time for governments to commit to resourcing their health systems in a way that out-of-pocket payments do not become an impediment to people receiving the care that they need. COVID-19 is a massive health crisis with huge socioeconomic consequences, but we're not going to solve it simply by dealing with the socioeconomic consequences. We've got to deal with the core health crisis. And that means providing health services, in the short run, testing, the treatments we can provide, in the longer run, better treatments, vaccines, and also managing and mitigating the knock-on consequences of other diseases. We've got to do that with urgency, and we've got to do that with determination. And I would also stress the huge importance of protecting frontline health workers. These are the single most important people in this situation. Africa already has a much lower ratio of frontline health workers to its population than richer countries in the world. You cannot afford to lose these people to sickness or isolation. So much depends on them being able to carry out their role. And I don't just mean those who are salaried doctors and nurses. I also mean the community health workers that play such a vital role in marginalized populations or in rural villages in bringing care to those who need it. So I applaud OAFLAD for holding this discussion at this vital time, and I can assure you the Global Fund is committed to working with you to support your countries as they navigate this extraordinary testing time, so that we mitigate not just the impact of COVID-19 itself, but its broader impact on other diseases, on the health system, and that we continue our momentum towards delivering universal coverage and health and well-being for all.
I want to jump right into the discussion, and I want to go back to Zimbabwe to talk about the situation there. Your Excellency, Madam Auxilia Mnangagwa, First Lady of the Republic of Zimbabwe, can you share with us 3 key health and socioeconomic impacts of COVID that have happened in your country, and what actions you have taken to support the national response to the pandemic?
Thank you. First of all, let me appraise you of the situation of COVID-19 in my country. Zimbabwe recorded its first confirmed COVID-19 case on the 20th of March 2020, and 4 months later, as of the 20th of July 2020, the total number of confirmed cases has risen to 1,611, with 25 deaths and 472 recoveries. In a short space of time, health systems, society, culture, and the economy have been turned upside down because of the COVID-19 pandemic. While the timely declaration of COVID-19 is a national disaster on the 27th of March by His Excellency E.D. Mnangagwa, the President of the Republic of Zimbabwe, and his subsequent pronouncement of a national lockdown on the 30th of March has had positive impact in helping slow the rise of new COVID-19 infections. Challenges have emerged as a result. The community has encountered difficulty in getting access to clinics and hospitals for essential healthcare services, and this has led to increasing numbers of people defaulting on their chronic medications, such as for diabetes and hypertension, HIV and TB, among others. Declining attendance of women and children for services such as antenatal care, labor and delivery, and immunization services has also been noted. Our culture and the way societies interact have been shaken to the core as communities learn to adjust to the new normal. No more shaking of hands, no more large social gatherings, including worship, weddings, or even funerals. At the same time, social distancing rules and intensified hygiene measures, including the wearing of masks, have been imposed in response to COVID-19. These restrictions are by no means easy to accept or practice, as these behaviors are deeply entrenched in our social and cultural practices as a people. An increase in sexual and gender-based violence has been recorded in the country since the advent of COVID-19, with statistics showing a 70% increase in GBV reports compared to pre-COVID-19 lockdown trends. At the same time, returning citizens from the diaspora have contributed to the rise in imported cases of COVID-19. Some of these returning communities to the infection. As a result, a rise in local transmission of coronavirus has been recorded, especially in the urban cities of Harare and Bulawayo. I am still continuing and intensifying my educational and information sharing activities on COVID-19 to the urban communities of Harare and proceeding also to Bulawayo as well. And my other question is, what actions have you undertaken to support the national response to the COVID-19 pandemic? As the First Lady of the Republic of Zimbabwe and my teams from the charitable organization, Angel of Hope Foundation, which I founded to advance the cause for the marginalized and vulnerable in the community, I have stepped up efforts to prepare rural communities, including the elderly, against COVID-19. I am doing this through enhanced education and awareness programs that emphasize on practicing hand hygiene, social distancing, cough etiquette, and use of face masks. At the same time, I have been distributing an assortment of hand sanitizers and personal hygiene kits for use by vulnerable adolescent girls and young women who cannot afford to buy pads on a monthly basis. Recognizing the hardships that have befallen families, especially the elderly, due to the socioeconomic impact of COVID-19, I've been moving to the rural and hard-to-reach areas in the country, donating food baskets to alleviate hunger. As the country is in the winter season, I've also distributed blankets to the elderly, disabled, and child-headed families. In order to tackle hunger more broadly, I'm helping communities set up grandmas or ambuyas garden, where they can grow fresh vegetables that can be used to improve their nutritional status. As the ambassador for health and child care in the country, it is my sincere hope that as we go all out to respond to the COVID-19 pandemic, the strengthening of the health system as our country seeks to achieve universal health coverage by 2030. I therefore welcome the donation that was made by the First Lady of China, which will go a long way in meeting the urgent need for personal protective equipment for our frontline workers, which I've already distributed through the China of COVID-19 Task Force here in Zimbabwe. In my interactions with the vulnerable communities and the elderly, I've been advocating against the gender-based violence, GBV, which has increased during the period of the COVID-19 lockdowns. I have also roped in traditional chiefs and religious leaders to be strong advocates against gender-based violence. As cases of local transmission arising, I've been educating traditional leaders and the elderly in the community about the course of action to take when returnees from across the borders come back into the community without following proper guidance for parenting. I am doing this to halt the further spread of COVID-19 within the local community. At the same time, I have capacitated the elderly in the communities to be health ambassadors who will raise awareness about COVID-19 symptoms and what to do when someone is ill or has died. What measures should be practiced to prevent the spread of coronavirus? I wish to applaud the work that is being done by the Interministerial Task Force on COVID-19 in constructing isolation facilities and improving the health infrastructure to be able to cater for those amongst us who, despite all the efforts done, will still somehow contract COVID-19. It is my sincere wish that scientists will find a vaccine and a cure in the not so too distant future in order to curtail this pandemic. I thank you.
Thank you, Your Excellency. As we've heard from Her Excellency, the First Lady of Zimbabwe, there are many health and socioeconomic impacts of COVID-19. The pandemic has exacerbated many challenges, and gender-based violence is one of them. So I want to call upon Your Excellency, Madame Neo Jane Masisi, First Lady of the Republic of Botswana, to tell us what your main concerns are around gender-based violence as a result of lockdown measures in place in many African countries. And tell us what more needs to be done to address gender-based violence in African countries more generally.
Thank you very much, Natalie. I'm honored to join my fellow sisters and excellencies, First Ladies of the African continent, in commending the Organization of African First Ladies for Development and Global Fund for initiating this series of webinars. As the African continent, we have over time registered significant progress towards gender equality and women's empowerment. It is, however, disheartening to note that the COVID-19 pandemic is taking us back and reversing the hard-earned gender equality gains, not only on our continent, but the world at large. As said earlier, gender inequalities that have haunted the African continent become more prominent in humanitarian and emergency situations, such as the COVID-19 pandemic, hence broadening the socio-economic disparities. The outbreak of the coronavirus has worsened the impact of existing societal challenges, such as HIV/AIDS, NCDs, poverty, and gender-based violence across Africa. The COVID-19 pandemic, which resulted in restricted movement of populations, resulted in an alarming increase in GBV cases, creating an additional pandemic. As UN Women has declared it, we have here a shadow pandemic within this wider pandemic. Modern moderator and my dear sisters, it is sad that the COVID-19 pandemic has relentlessly dislocated the normal functioning of populations across the world. As much as the COVID-19 pandemic threatens the health of all, women and girls remain disproportionately affected. During this period, pre-existing gender inequalities and power dynamics that fuel violence in the homes has worsened due to extended quarantine and other socioeconomic stresses. What makes it worse is that lockdown measures force women to stay at home with their abusers, whilst cut off from normal support services. It would, as a result, not be shocking to realize a spike in gender-based violence, mainly from intimate partners. There's also rape, defilement. We are seeing sexual abuse and femicide cases on our continent. What makes it worse also is that these victims are in close proximity to these perpetrators, who are supposed to be husbands, intimate partners, uncles, cousins, and caregivers, thus rendering the homes unsafe havens during this period. We must realize that in a lot of cases, our already existing small dwelling places become even smaller during lockdown. They literally shrink. I mean, think of that hut in the rural area. Main concerns around GBV as a result of lockdowns. People have lost their capacity to earn a living due to business shutdowns or scaling down. These cause severe stress on families, the financial worries being a source of conflicts. Women who made a living from the informal sector, which had the majority in our sort of societies, where they earn revenues on a day-to-day basis, they're no longer able to make that income. This means that they place more dependency on partners, and this in turn increases the partner's power and dominance, which unfortunately results in this abuse. These women fear to report these cases, as they would be homeless if at all they are thrown out of the home. Women who form a large part of our subsistence farming sector could not go to tend their fields. Hence, they lost their crops. This meant lost earnings. Again, increased dependency on potential perpetrators. The restricted availability of support services during lockdown did not help at all. In our case, for instance, it required permits to move around. It meant one is unable to see family or institutions which normally provide the support and counseling. Additionally, because spaces are confined, the victims found it difficult to even place a phone call to helplines or call centers, in the fear that if they are heard, the perpetrator may cause additional harm. The lockdowns have also highlighted the fact that there's a critical shortage of safe shelters for victims, especially where a woman sought protection for both herself and children. Domestic conflicts and tensions which were avoided during the pandemic because partners would be engaged at work during the day came to the fore during lockdown as couples stay home and they're forced to talk to each other and address these issues. Men who were engaged in extramarital affairs, small homes, they found an avenue to vent out by either sexually abusing young girls in the home or being abusive towards the spouses. Furthermore, the COVID-19 situation has made it harder, if not impossible, for screening for sexual and gender-based violence, as efforts and resources are channeled towards the prevention and containment of the disease. In addition, referral pathways continue to be disrupted. On this premise, it is worth noting that the repercussions of sexual and gender-based violence do not end when medical crises are contained. Hence, the need for a comprehensive response and recovery plan for the wide range and long-lasting challenges, which may be generational as well. As we all battle with COVID-19, it is imperative that we draw lessons from the pandemics that hit our continents before, such as HIV/AIDS and Ebola. Mistakes made during these epidemics are valuable lessons in the COVID-19 response. Key being that women and girls remain disproportionately affected. To this end, our continent must ensure the protection of women and girls right from the beginning of an epidemic. On this note, women and girls must be part of the response plans, from development to delivery of services. What more needs to be done to address GBV in African countries? Certainly and clearly, from the statistics, a lot more needs to be done. For effective response, it is important that Africa adopts the PPR approach, that is prevention, protection, and response, as advocated for by the United Nations. We need, however, to add an S there, which represents support, and R for research. The PPRSR approach would then call for prevention, where there's a need to have comprehensive strategies that are multi-sectoral and multi-pronged at all societal levels to prevent GBV from occurring the first time. Protection. In the event GBV occurs, wide-ranging and inclusive systems to protect victims and survivors ought to be adopted, including laws that protect women. We should have tougher legislation. We must also have stringent bail criteria and enforce restraining orders in order to protect the victims. Response. We must adopt customized or community-based response structures that are effective to respond to GBV, that is, have clear referral pathways and ensure timely access to services, as well as access to justice. Support. in recognition of the need for psychosocial support and provision of safety nets, especially that the burden of caring is further exacerbated by pandemics. We must adopt systems that fully support GBV survivors and victims at all levels. We need shelters, we need psychosocial support, and we must educate both women and the perpetrators. Research. This is an area that could easily be neglected. We need to deepen the understanding of GBV, especially in our context in Africa, particularly around the mind of the perpetrator, what is in the mind of the victim, especially those victims who forgive the perpetrators and finally get murdered. And finally, we must also interrogate our cultural norms and belief systems. At national level, it is imperative that traditional and religious leaders, as well as men and boys, continue to be engaged on issues relating to gender-based violence and equality and prevention of GBV and COVID-19 response in order to break gender stereotypes that are perpetuated by our own cultural norms and practices. Their engagement would further strengthen initiatives that would serve as early warning and alert systems within communities. Africa may leverage on modern technology to engage youth, to engage people with disabilities in promoting safe spaces for women and girls. However, it is important that we explore alternatives, not to exclude communities with limited access to modern technology, which actually represents a majority of our communities. In that case, we could have the creation of mobile services. Africa needs to continue strengthening efforts in building women's resilience to adapt to the COVID-19 future shocks. Women empowerment must be accelerated in the areas of skills development, education, and opportunities for economic activities that in the end enable self-care. As the First Lady of the Republic of Botswana, I assure you that I remain committed to support all continental efforts in the safety and protection of women and girls during this pandemic. Madam Moderator, I thank you at this point, and perhaps it's worthy of me to mention that I apologize because I'm going to have another session and I'm going to be leaving in the next 8 minutes. But thank you very much. It's great to see you, my sisters, again. I miss you all. And thank you very much.
Thank you very much, Your Excellency. As you said, I think the word shadow pandemic is very important, and the need to change cultural norms to provide opportunities so that the stigma and both the challenges that come with gender-based violence are eradicated. Now I want to turn towards the DRC. Excellence Madame Denise Nyakero Tshisekedi, Première Dame de la République démocratique du Congo. J'aimerais parler de votre expérience en RDC. Quelles sont vos études liées à la violence fondée sur le genre, résultant dans des mesures de confinement en place dans de nombreux pays africains? Et quel faut-il faire de plus pour combattre la violence fondée sur le genre dans nos pays africains?
Permettez-moi de commencer cette réunion en félicitant ma sœur Antoinette Sassou-Nguesso, Première Dame de la République du Congo et présidente de l'OAFLAD, pour son leadership à la tête de notre organisation, mais aussi en la remerciant pour m'avoir invité à ces échanges. Je salue aussi ma sœur Olivia Nangabo, Première Dame de Zimbabwe et vice-présidente de l'OAFLAD, et la remercie de conduire nos échanges à ce jour. Je salue chaleureusement mes consoeurs Première Dame, membres de l'OAFLAD ici présentes, la secrétaire exécutive de l'OAFLAD et son équipe, ainsi que tous les participants à cette réunion virtuelle. Je partagerai brièvement avec vous autour des mesures de confinement consécutives à la pandémie COVID-19, telles qu'arrêtées par la plupart de nos pays, et l'impact qu'elles ont eu sur les violences basées sur le genre. Vous comprendrez qu'étant championne des Nations Unies sur les questions de prévention des violences sexuelles liées au conflit, et ambassadrice UNFPA pour la lutte contre les violences basées sur le genre et l'autonomisation de la femme. Toutes les questions liées aux violences me préoccupent fortement. Tout d'abord, le coronavirus a surpris l'humanité entière et personne n'y était vraiment préparé. Dans la recherche des premières solutions, les gouvernements ont pris des mesures pour limiter la propagation de la pandémie. Et ces mesures concernent, entre autres, le confinement total pour certains ou géographiquement ciblé pour d'autres, la fermeture des écoles, centres de formation et universités, la suspension des rassemblements publics, et j'en passe. Ces mesures ne sont malheureusement pas sans conséquences, notamment en ce qui concerne la lutte contre les violences basées sur le genre. Et de ce fait, j'émets quelques inquiétudes. Certaines d'entre elles ont déjà été ou seront certainement exposées au cours de cette rencontre virtuelle pour ma part. J'en ai listé 6 et je m'en vais rapidement vous les citer. 1. Le système sanitaire de nos différents pays en termes de continuité, de disponibilité et d'accès aux services de santé sexuelle et de la reproduction est lourdement impacté par les mesures de confinement. 2. La demande des services de planification familiale, des consultations prénatales, l'accouchement assisté en structure médicalisée a diminué. Les conséquences seront l'augmentation de cas de morbidité et de mortalité maternelle, telles que les fistules obstétricales, les décès maternels et néonatals, les rapports sexuels forcés sans protection avec une augmentation de IST, HIV, des grossesses non désirées avec risque d'avortement provoqué et des complications. 3. L'oisiveté des enfants. Conséquence directe de la fermeture des écoles, favorise certaines violences à leur égard et le mariage d'enfants dans certains de nos pays. 4. Les activités de sensibilisation sur les pratiques néfastes et leur suivi fait par les ONG et autres structures ne sont plus possibles ou sont lourdement en baisse, ce qui ne permet pas d'encourager les auteurs. 5. La COVID-19 limite la possibilité pour les victimes et les personnes rescapées de dénoncer les actes de violence. Dans plusieurs pays d'Afrique, la pandémie a des répercussions sur les capacités d'enregistrement des plaintes, sur le traitement des signalements, ainsi que sur la poursuite des dossiers en instance au niveau des juridictions nationales. 6. Le confinement combiné aux impacts négatifs sur les revenus des ménages contribue à l'accroissement de la pauvreté, un des facteurs non négligeables de l'augmentation des cas de violence domestique et sexiste. Vu de cette manière, nous pouvons rapidement voir que les impacts de la COVID-19 et les mesures prises pour les contenir sont importants sur le plan non seulement socio-économique, mais également sanitaire. En effet, les conséquences des violences, notamment sexuelles, sont énormes tant sur la santé des victimes et leurs proches et sur la société. Les limites de nos systèmes sanitaires ressortis par cette pandémie font craindre que la couverture sanitaire universelle ne soit pas facilement atteignable dans les délais convenus. Des ajustements rapides doivent se faire. Même si la sensibilisation demeure une arme efficace à la fois pour lutter contre la COVID-19 et les violences basées sur le genre, je ne pense pas qu'il y ait une solution miracle. Continuons à travailler dur pour sensibiliser nos populations, pour améliorer leur prise en charge et les autonomiser au maximum. Les échanges d'aujourd'hui devraient nous permettre de dégager des pistes de solutions pour nous en sortir durablement, c'est-à-dire à la fois vaincre la COVID-19 et se donner les moyens d'atteindre l'objectif de couverture universelle en matière de santé, qui vise à ce que tous les individus aient accès aux services de santé sans encourir des difficultés financières. Mesdames et messieurs, je vous remercie.
Merci beaucoup, Votre Excellence. J'aimerais maintenant aller au Niger et je vois qu'il y a toute une équipe derrière Son Excellence. Je veux aussi vous remercier de votre présence. Excellence Madame Aïssata Soufou Mohamedou, Première Dame de la République du Niger. Quels sont les 3 principaux impacts sanitaires et socio-économiques du COVID-19 au Niger et quelles initiatives avez-vous entreprises pour soutenir la réponse nationale à la pandémie? Et je voulais juste indiquer que vous êtes avec le secrétaire général du ministère de la Santé publique, le président du CCM représentant le Fonds mondial au Niger, la représentante du OMS Niger et le représentant ONU-SIDA au Niger. Je vous remercie.
Merci. Madame la vice-présidente de l'OBDAS, Son Excellence Madame Auxilia, Première Dame du Zimbabwe, mes chères sœurs, Première Dame d'Afrique, Monsieur le directeur exécutif du Fonds mondial, Petersons, Monsieur le secrétaire général du ministère de la Santé, représentant le ministre de la Santé publique du Niger, je voudrais saluer également toute l'assistance à ce premier webinaire qui se tient dans un contexte de crise sanitaire. Pour revenir aux questions, je voudrais d'abord, pour la première question, scinder la question en 3 points, c'est-à-dire le point concernant les impacts sanitaires, ensuite les impacts sociaux et enfin les impacts économiques. Sur le plan sanitaire, on peut retenir un impact négatif sur l'utilisation des services de santé, tant sur le plan préventif que curatif. Cela a drastiquement réduit les performances des services de santé, surtout en ce qui concerne la couverture vaccinale des enfants, le suivi de la croissance des nourrissons, les accouchements assistés par le personnel de santé, le suivi des grossesses, la prise en charge des maladies aiguës et chroniques telles que le VIH-Sida, la tuberculose, le paludisme, pour ne citer que ceux. Ensuite, la survenue des contaminations COVID intra-hospitalières avec une forte proportion des agents de santé contaminés et qui, par la suite, contaminent leur famille, ce qui est dans la logique de cette maladie. Le recours à l'automédication ou autres remèdes face aux affections courantes. Sur le plan social, on retiendra la propagation des rumeurs de tout genre relatifs à la pandémie en développant des fois des notions contraires aux mesures en faveur de la gestion de la pandémie. La psychose générale face à une situation inédite. La stigmatisation à l'envers des personnes et des familles infectées et ou affectées. La répercussion sur les interrelations sociales jadis connues à la culture africaine en cas de mariage, baptême ou toute autre cérémonie festive. La fermeture des établissements scolaires avec toutes ses conséquences sur la baisse du niveau des enfants, l'exposition à la délinquance juvénile par les mauvaises fréquentations, la déscolarisation de certains enfants, dont les filles, et les répercussions certaines que cette situation aura sur les examens scolaires. Sur le plan économique, on retiendra la baisse des investissements internes et externes globaux, la réduction des revenus des entreprises, des familles et même des individus qui vivent des activités du jour au jour. Le Niger, vous le savez, est un pays continental. Je m'en vais répondre à la deuxième question, à savoir les initiatives prises pour soutenir la réponse à la pandémie. Au plan national, ainsi, face à cette pandémie, des mesures ont été prises dans mon pays. le président de la République s'est adressé à la nation bien avant la notification du premier cas et a annoncé la prise de certaines mesures afin d'atténuer les effets négatifs liés au COVID. Sur le plan sanitaire, on peut citer la sensibilisation des populations sur les mesures de prévention, l'élaboration d'un programme global de réponse à la pandémie de COVID, l'élaboration d'un plan de contingence national COVID-19, la signature d'un décret d'état d'urgence sanitaire, le recrutement à la fonction publique de 1500 agents de santé, médecins, infirmiers, techniciens, sages-femmes, etc., pour faire face à la situation. La fermeture des établissements scolaires, des lieux de culte, des frontières terrestres et aériennes. L'isolement et le couvre-feu de la ville de Niamey, épicentre de l'épidémie. La poursuite de la continuité des services de soins de pathologies chroniques. La décentralisation du diagnostic par la PCR au niveau des 3 régions à l'intérieur du pays. La confection et la distribution des masques et du matériel de lavage des mains. L'arrêt des transports en commun inter- et intra-urbains et la fermeture des frontières terrestres et aériennes. La mise en place des sites de prise en charge dédiés au niveau de chaque région, pour ne citer que cela. Sur le plan économique, les mesures sociales prises par le Niger sont la prise en charge pour les mois d'avril et mai pour le paiement des factures d'électricité et d'eau pour les tranches sociales, le renforcement du plan de soutien aux personnes vulnérables, distribution gratuite, vente à prix modéré des vivres, la remise gracieuse de peine en faveur de 1540 détenus pour des raisons humanitaires et pour désengorger les maisons d'arrêt. La mise en place des facilités de crédit d'enlèvement pour tout importateur. La prise en compte de certaines mesures pour reporter la date de paiement de la vignette, suspendre les contrôles fiscaux, assurer l'exonération de la TVA ou sa réduction, la suspension des poursuites en matière de recouvrement des impôts et taxes. L'augmentation par la BCEAO, Banque centrale des États de l'Afrique de l'Ouest, du volume de liquidités injectées chaque semaine sur le marché monétaire en faveur des banques. Pour soutenir le gouvernement dans la réponse à la pandémie, j'ai engagé les actions suivantes. La mise en circulation d'une vidéo de sensibilisation de la population sur les consignes de prévention contre le COVID-19, notamment le lavage des mains, dès le mois de mars 2020. 2. La distribution des vivres aux personnes vulnérables. 3. La donation des masques aux enseignants de différents ministères de l'Éducation et de la Formation lors de la réouverture des établissements scolaires publics et privés, mais aussi au ministère de la Défense nationale. Ensuite, point 4. Ensuite, une mise en circulation d'une seconde vidéo sur le port de masque dès la prise de décision par le gouvernement de lever le couvre-feu et de déconfiner la ville de Niamey. 5. Le plaidoyer pour la mobilisation des ressources additionnelles en appui au gouvernement pour faire face à la pandémie. Dans un futur proche, nous procéderons à la donation d'équipements de prise en charge, thermomètres, respirateurs, les goupillons pour tests PCR, les masques, etc. Je ne finirai pas sans remercier le Fonds mondial pour tout ce qu'il fait pour le Niger, notamment pour les 3 programmes SIDA, tuberculose et paludisme. Je remercie tous les partenaires qui nous ont assistés pour cette webinaire, la première en ce qui concerne l'OBDAS, et je remercie tous les organisateurs.
Merci beaucoup, Excellence. And now I'd like to call upon Excellency Ambassador Catherine Mwangi, the Kenyan ambassador to Ethiopia, Djibouti, the African Union, IGAD, and UNECA. I would like to come back to you. The First Lady of Botswana and the DRC have already addressed this question. I would like to know if you have anything to add. What are your main concerns around gender-based violence and the results of lockdown measures in place? What do you believe needs to be done to address gender-based violence in our African countries?
Okay, thank you very much, moderator. Your Excellency, Madam Auxilia Mnangagwa, the First Lady of Zimbabwe, and OAFLAD Vice President, Your Excellencies, First Ladies, my co-panelist, Dr. John, Director of the CDC, the Center for Disease Control and Prevention, distinguished participants. Let me start by bringing greetings, warm greetings and very best wishes from my own First Lady, Her Excellency Margaret Kenyatta. She asked that I convey her warm greetings and all for this deliberation. Indeed, you're right, Madam Moderator, Her Excellency, the First Lady of Botswana, very eloquently handled this matter of gender-based violence. So I find myself almost without anything to say because it may seem repetitive, because I think the dynamics and that she elaborated on, and in fact also the First Lady of Zimbabwe had touched on the challenges they're facing, especially women and young girls, in relation to gender-based violence in these times of lockdown, are similar. They're similar to all our societies, and therefore I feel that most of the things I would have said have been covered. But I guess maybe just to touch on a few things that I feel that countries need to be doing to be able to deal with the situation, so that indeed we prevent a parallel crisis, because we're dealing now with a crisis of COVID. But with the challenges and the threat that is posed by gender-based violence, we indeed are facing a huge crisis. So I guess governments and countries need to ensure that the response to COVID-19 does not reproduce or perpetuate harmful gender norms, discriminatory practices, including within the quarantine experience. To mitigate the risks faced by women and girls as a result of COVID-19, it is important from the outset to consider the gendered impacts of COVID-19 and respond accordingly. I think countries need to apply gender analysis when developing outreach messages to the general public on public health measures, including tailored messaging directed to men and women, as specificity will be donated with the right intended audiences. Need to ensure that social protection systems and measures are put in place by governments to address gender risks over the course of the outbreak, as they play a vital role in protecting women from poverty and insecurity, helping them and their families cope from the outbreak and recover from other economic and social shocks, and ultimately promote and protect their rights. I believe that it is also necessary to ensure that community-based protection systems are still effective to protect women and girls from gender-based violence, and also girls at risk of female genital mutilation and early and forced pregnancies and marriages, especially in conflict-affected areas where health and education services have been interrupted and health and other infrastructure badly damaged. It's important that governments consider adopting policies and interventions such as women and girls safe spaces at homes, schools, and communities, and also scale up remote modalities for service delivery, including for case management and psychosocial support with accompanying training staff support, and quality care. And really, finally, I believe that there could be opportunity to provide girls with dignity or hygiene kits. Many of these adolescent girls, menstruation is already challenging to navigate, and many girls will also get their first period during this time. There may be issues related to their access to communal wash facilities and their ability to wash and access sanitary products. And finally, governments need to raise awareness of police and judiciary about the increase of violence against women. So those are just some of the things that I wanted to share as ways that government or mechanisms that governments can put in place to mitigate for gender-based violence, especially at this time of COVID-19. I thank you, Your Excellencies.
Thank you very much. I just want to highlight a key statement you made around gendered analysis of the current situation and looking at responses from a holistic perspective. I think that both the First Ladies of Zimbabwe, Botswana, and the DRC brought this up and what they're doing in their own countries. And I'd like to turn to Dr. John Nkenkason, Director of the African Centers of Disease Control and Prevention. It's really good to see the Africa CDC taking a prominent role in response to COVID-19, providing information and receiving funding required to do some of the things that you're doing, although I suspect it isn't enough. Can you let us know what critical lessons Africa learned from the Ebola outbreak on the importance of maintaining essential health services during a pandemic such as COVID-19, and hopefully we'll learn this lesson now. Thank you so much.
Thank you. Can you hear me?
We can, yes.
Okay, wonderful. So before I begin, I would like to first share my gratitude to Her Excellencies, Madam Antoinette Sassou Nguesso, the First Lady of the Republic of Congo, and all the First Ladies for the kind invitation to join you all this afternoon for this critical discussion. First of all, the COVID pandemic on our continent has gathered full momentum and is on the increase. Just again to refresh our minds where we are. As a continent, we are of 55 member states. We've reported about 750,000 cases of COVID infections and about 15,000 deaths. What is important to retain with our numbers is that we are now seeing a weekly increase of about 100,000 new cases. And we suspect that this week, when we summarize our findings, it will be more cases than the previous week. And to be more responsive to the question around Ebola outbreak in West Africa and the lessons learned, I would like to share a few numbers with you. First of all, if you look at Guinea, for example, we saw that because of the Ebola outbreak, there was a 46% drop in HIV testing and a 47% decline in the number of enrollment of patients that were seeking treatment. We also noticed in West Africa that tuberculosis, the number of new cases of tuberculosis that were seeking treatment decreased about 53%. And in Sierra Leone, children under 5 years that were receiving malaria treatment declined about 40%. And lastly, if you look at the vaccination, more than 1.5 million children went without vaccines because of the Ebola outbreak. And that is the scenario we fear most on this, with this respect to the COVID-19 outbreak. Now, let me share with you some, at least 3 lessons or take home messages. First of all, and very critically important, is that in order to protect the harm of COVID-19 to these endemic diseases, i.e. TB, malaria, tuberculosis, and immunization, we have to engage the local community in a very decisive manner. Disease outbreaks, in fact, create a separate ecosystem and a challenge on its own, and give way to complex socio-anthropological layers that must be considered and incorporated in each response. We have to engage the community in a way that so that we understand and explore indigenous knowledge and societal values. For example, engaging prominent community members, religious leaders, and other civil society leaders is so important and critical for us to protect the existing services, i.e. immunization, tuberculosis program, and malaria program. The second takeaway message I would like to leave with you all is the need to ensure that we have a competent workforce that does two things, that ensure that we respond effectively to this COVID-19 challenge, but also continue to ensure that the essential services are protected. We have to protect our healthcare workers in a meaningful way, as these are people that protect us. And as we already know, so many healthcare workers have now been infected by COVID-19 on the continent. We have to work carefully and deliberately to ensure that this is not the case and that those who are infected do not actually die. Otherwise, it will be extremely difficult for us to contain other endemic diseases. The third and last message I would like to share with you is that of misinformation. As we have seen in this new informal, in this new age of information technology, there are so many outlets out there that people are using to get information into the community, the so-called social media. As much as it has the capacity to do good, it has tremendous capacity to do significant damage. So we have to go back into our communities and make sure that the right information is provided so that we can access the right services appropriately and use the grassroots approach and to engage them so that we begin to push back on this misinformation. Without understanding the local context, what the community beliefs are, who influences the policy and the politics in the community, it will be very difficult to effect behavioral change. Social media and other outlets have a frightening power to disrupt health services, potentially undoing long-term efforts to empower communities to be vigilant and proactive when it comes to public health. And lastly, by taking these three factors into consideration, we can take the necessary actions to ensure that our public health staff, facilities, and nations overall are adequately prepared to deal with a pandemic without risking loss of essential health services to the general public. I'll end by recommending 4 things that we must do collectively to fight this pandemic at this stage of the challenge. One is that we need your help as First Ladies to expand testing. Expand testing in the community level in an expansive manner. Second is that we need your help to ensure that once people are tested, there is contact tracing. Using community healthcare workers. And thirdly is to mobilize the community so that they become an enabler to facilitate the expansion of testing as much as possible and create trust with their community. We have to do that now and do it very decisively and begin to use the power that you all have to prepare the future for access to vaccines so that the whole anti-vaccine movement is blunted. Otherwise, our future and our development will be compromised. I thank you for your kind attention.
Thank you very much. We were going to come back to you at the end, but you've given us a very strong key next steps to make sure that we're containing COVID-19. I'd like to, before we bring on other First Ladies, I'd like to go to Dr. Rupa Dutt. She's CEO of Women in Global Health, and she's an internal medicine physician herself. I want to talk about sexual reproductive health. How can existing services be adaptable to ensure access in light of COVID-19? As the First Ladies have already mentioned, there has been a disruption of these services, the provision of these services to women, and this is causing, as was mentioned earlier, a shadow pandemic. So what can be done? How can they be adaptable?
Foremost, thank you, Excellencies and esteemed fellow guests. It's really a privilege to be here. And let me first acknowledge that Africa is a continent with strong female leadership, and we must use it. Women are a majority of the health and social care. They make up 70% of the health workforce, but only hold 25% of senior roles. The expertise and the women power is out there, and we must really use it. So first, I'd say really to respond to the sexual reproductive health rights and needs of girls and women and all genders, we must ask women and ask health workers, especially community health workers and midwives, for their perspective in our response in reaching girls and women for their health needs. We must listen to the opinion of women who know the health system best. They are a majority of the frontline response, and they are the experts. It's really their time to lead. Second, we must be gender responsive and especially addressing the needs of girls and women by treating SRHR, sexually reproductive health rights, as essential services and part of universal health coverage, not optional, or we will lose the progress made and be derailed from the pathway to achieving the SDGs. We must respond based on lessons learned from other disease outbreaks, including Ebola. I'm going to give you a few numbers of global estimates as a result of what COVID-19 pandemic may potentially do. We are expected to see 2 more million cases of FGM, 7 million more unintended pregnancies, 31 million more cases of gender-based violence, 47 million women will lose access to contraceptives, while 100 million people are expected to enter into extreme poverty. And all this will result, per the World Bank, in 1 trillion loss in human capital in the next generation if we do not do things differently. So this is of great urgency to be gender responsive. This is not about a gender war. There's only one health system that must respond to all genders, and gender equality will benefit us all. We need to ensure during lockdowns the safety of girls and young women are prioritized, or we will lose a generation of progress for girls and women. We must ensure access to SRH services, including access to testing, contraceptives, maternal and neonatal care, and not see this as optional. We must provide support services and continue peer-to-peer services to support and counsel young people and keep them engaged. 3, applause is great, but safe and compensated decent work is better. Women are health workers. They're being applauded and recognized as heroines in the pandemic. We too must applaud their extraordinary resilience and commitment to this profession. But health systems established by men for men have been slow to respond and recognize that the default health worker is a woman and that she has different needs. The needs of female health workers in COVID-19 now include ensuring their safety as they move from communities, personal protective equipment that actually fits women, and policies that don't assume women can work long shifts in hospitals while at the same time taking care of their children, their elderly relatives, their communities, and carry the burden of domestic work. For too long, women have been the social shock absorbers in times of crisis. We must turn applause into decent and safe work for women in health and social care and keep it equally paid. This is going to be essential to achieving the SRHR agenda. There is a danger that after this pandemic, women will be expected to return to their gender roles, undervalued, uncompensated, and unprotected, and this will leave us all vulnerable. We must recognize the value of women's unpaid health and social care work and bring it into the formal labor market. 4, we need to stop working blind. Data matters, especially gender data. Currently, only 52 countries out of 193 are reporting sex disaggregated data on COVID-19 to the WHO. Without sex disaggregated and gender responsive data, we are working blind in this pandemic, and we will not document the lessons that we need to help combat future health challenges, including the current. When we fail to document gender lessons from emergencies and pandemics, women and girls pay with their lives. 5, fund women's movements to unleash capacity to address critical gender issues, especially those that are based in lower middle income countries are at most risk and are underfunded. Only 1% of gender-focused donor aid to civil society went directly to women NGOs in low-income countries. We know women are the shock absorbers. We must support them, both financially and through decent conditions. COVID-19 has disrupted business as usual on a global scale, giving us an opportunity to reimagine the future, build back better. Let's be gender responsive. Let's keep SRHR as an essential. In return, we will gain the triple gender dividend, health, gender, and economic benefits for all. Thank you.
Thank you. I just want to reiterate some of the important things you said about seeing sexual reproductive health services as essential, not optional, and also thinking through the health workers, female health workers, their needs, and also getting data, critical points there. As I said earlier, we're going to get some comments from several First Ladies who have also joined. I want to start by Her Excellency Dr. Ana Dias Lorenzo, First Lady of the Republic of Angola, who's going to say a few words.
Thank you very much for this opportunity. I would like in the first time to congratulate the initiative of OAFLAD and the Global Fund to take us the opportunity to share our vision about the situation, the pandemic of COVID-19. At this time, I don't have more things to add for my sisters from Botswana said and from DRC, because I send to OAFLAD and to the Vice President of OAFLAD my contribution. And I think in this time, I would like to see maybe at the end of this meeting, or perhaps next few days, to receive our conclusion about this discussion. Because the First Lady of Botswana, the First Lady of DRC and Niger take this important issue, and I think the situation is similar for the whole country in Africa. For me, I think you need to do more to take our health system more strong in our country, and maybe we can see other things to do in the health sector. I think for me at this time I don't have more things to add. Thank you very much.
Thank you, Your Excellency. We wanted also to hear from Son Excellence Madame Brigitte Taudera, Première Dame de la République centrafricaine, si vous avez quelque chose à partager avec nous. Votre Excellence, votre micro, vous êtes sur mute. Okay, what we'll do is we'll hear first from Her Excellency Dr. Isaura Nyusi, First Lady of the Republic of Mozambique, and then we will come back to the First Lady of Central African Republic. Your Excellency Dr. Nyusi.
Quero agradecer esta oportunidade, saudar a nossa presidente, vice-presidente da nossa organização, dizer que eu quero agradecer por esta oportunidade de estarmos aqui a debater assuntos sobre a Covid, que tem preocupado a todos os países, em particular a África. Os problemas da Covid são comuns, o que estiveram aqui a referir as primeiras damas do Zimbabwe, do Congo, do Níger, e acabou agora também de falar a primeira dama do Angola. São problemas que afligem a todos nós e, de facto, o que é importante agora é que nós todos, de mãos dadas, melhoremos as nossas ações para o combate a esta grande pandemia. Muito obrigada a todas.
Thank you very much, Your Excellency. I wanted to make sure that we bring on Her Excellency Madame Brigitte Taudera if she's there. If not, we will proceed. I noticed that she's on mute for the moment. Very well. What we'll do first is bring on discussion around citizen engagement. We have a question also that was asked around CSOs and action in response to COVID, because we can't beat the virus, as Dr. Nkegasong mentioned, without public ownership and participation. So Ms. Yassine Jibo, Executive Director of Speak Up Africa, can you tell us a little bit about Speak Up Africa, and can you share about the impacts of COVID-19 on the community voice, civil society, community engagement, and how to do more of that so that we can beat the virus?
Absolutely. Thank you very much, Madam Moderator. Good afternoon, Excellencies, First Lady.
I think we're having trouble hearing you.
Can you hear me now?
We can see your lips, but unfortunately we can't hear you.
Can you hear me now?
No, we cannot.
We can hear you here.
So some people can hear me and others not? Okay, well, I'll start, and thank you so much for the invitation. Good afternoon, Excellencies, First Ladies of Africa, distinguished panelists and partners. It is a pleasure for me to be here today. My name is Yassine Jibo, and I'm the Executive Director of Speak Up Africa, an advocacy action tank based in Dakar, Senegal. And as we've been able to see with the COVID-19 pandemic, there has been a lot of flaws and drastic inequality, and call for change is really coming from all across the globe, from citizens and advocacy groups to some of the largest global companies. And we really have noticed that there's a strong need for targeted action, but for that change to be effective, we believe that all sectors of society need to be involved, especially civil society organizations. And the way we see the civil society response is really around three ways in which they can intervene. The first one around representation. So while we've seen during the pandemic that a lot of the privileged have been able to isolate without worrying about their income, a huge number of people have experienced a lot of hardship in terms of having to isolate in small spaces, living in difficult conditions, and the need for civil societies to speak out for those groups of vulnerable people is critical. And we need to continue to advocate to ensure that they have access to water and that they're able to protect themselves and their communities. The other important factor we see for civil society engagement and the work we do is really in analyzing government action and ensuring more transparency and accountability to be able to build a more fair and just and rights post-pandemic future. And for us, being able to ensure that that happens and being able to provide the tools is critical in being able to provide that accountability. And the last one, which many of my panelists have touched upon, is around the need for information and really ensuring that accurate information is available for our communities. Because as Dr. Gengsagon said, there's a lot of misinformation, and misinformation can be very negative in terms of the impact. So we really need to ensure that we have accurate information and that we're able to use those voices. And when we work with communities and population in the COVID-19 response, we really need to ensure that we know what these specific groups might experience in terms of barriers to the information, in terms of language, in terms of their exposure levels, and really what are the types of impact, especially when it comes to children and people living with disabilities. As has been mentioned earlier on, they're often forgotten and not accounted for. So we really need to ensure that as governments are continuing to work to reduce the spread of COVID-19 and develop inclusive response and strategies, that we're able to consult and work very closely with these affected communities to engage them and ensure that there are champions of change in reaching out to their peers, to their communities, and as part of the response. And you know, we really commend the work that the First Ladies have been doing, and really the leadership role you've had, and continuing to ensure that these vulnerable groups, these children, are accounted for in our strategies. As Speak Up Africa, in April, we decided to launch a campaign called Stay Safe Africa. And the idea there was really to be able to bring together policymakers as well as communities across the continent, not only to prevent the spread of the COVID-19, but to ensure access and treatment for other essential services for health, as was mentioned earlier on, such as malaria, neglected tropical diseases, and ensure that the gains that had been made are sustained, and and ensure that we're able to support that effort. And some examples of work we've done in Senegal: we partnered with Special Olympics in ensuring that we were able to deliver face masks for their athletes, but also their families. We also worked with another group to deliver hand washing stations in schools and communities in support of the Ministry of Education. And the last key activity that we've also been working on is to work with the media and develop an online series that would allow us to have conversations such as the ones we're having today that are critical to ensure that we have the proper policies in place, that they're inclusive, that they're gender sensitive, and that the fight against COVID-19 is a shared responsibility that we need to all work together on. And if we work in partnerships, we believe that we're able to get far, and that's why through the platforms that we develop, we very much want to work with communities as well as governments, as well as organizations such as yours, and of course with your excellencies, First Ladies, and really seeing how we can use your voices to advocate on these various health issues. And just in conclusion, it is critical for us to continue to meet the needs of communities. We have seen through this pandemic how unequal our systems are and how vulnerable some of these groups are. And we really need to establish a new social order. And we feel that the voices of the communities, of civil society, is critical and indispensable in this new push for change. And we really look on all of you to work with us to advocate for groups and communities to be included in the response. As was mentioned by the Africa CDC director, it is critical for communities to be a part of the solution, to understand their role, and for everything to be adapted to all of these contexts. So again, wanted to thank you for the opportunity of being able to contribute to this critical conversation today, and commend all of the First Ladies of Africa for your tremendous leadership, and looking forward to working together to stop COVID-19 and have a healthy and prosperous Africa.
Great. Thank you so much. I unfortunately was having trouble hearing you, so I know that everybody else heard from your important remarks there. Before we wrap up, I just want to bring back Dr. Kegasong to talk to us. He briefly mentioned the 3 or 4 things that we must do to respond to the crisis as we are now, as we're opening, as we're seeing an uptick of cases, 100,000 jumping a week. Can you come back and tell us the 3 or 4 things that you want us to focus on? And then we'll hear closing remarks from the First Lady of Zimbabwe.
So as we unlock our economies, and appropriately so, there are a couple of things we must do, and do that collectively. First of all is that we need to work to ensure that public health measures are seen as complementary to the economy. That is not whether we save lives versus save livelihoods, but we have to work together to save lives and save livelihoods. And there are a couple of things that we believe that as a continent we must do together, and do it boldly. One is to ramp up our testing. and make sure that our frontiers and the borders are also equipped with testing devices. That is the only way we'll be able to begin to move freely again on our continent and secure our economies. Second is that we need to strengthen our surveillance systems, because as we unlock our systems, we'll see naturally an increase in the number of cases of COVID-19. And there will be hotspots. The hotspots will only be identified by good surveillance systems that we put in place by supporting our public health systems to pick that up and react to it quickly so that we can contain those outbursts or hotspots. The third thing we must do is our community, as I said, that the masking that we are recommending, and I'm very pleased that in certain cities like Addis Ababa, where I live, when I drive down the street all over the center of the city, I see most people, or nearly everybody, wearing masks. We have to do that in a very consistent manner and in a way that is sustained. And that is where the local community will also need help to make sure that even though these masks that we are recommending appear cheap, because of our very weak economic buying power, that some communities, some vulnerable parts of our community may not be able to acquire this mask, and the government have to support them to carry that mask. Lastly, communication is so important. We must communicate effectively with our communities so that we empower them in the areas of building trust, in the areas of building community, in the areas of building leadership and ownership of the response. The battle against COVID-19 will be won or lost at the community level. We have to be absolutely clear. These are lessons that we learned from the HIV. These are lessons that we've learned from the Ebola outbreak. So we are in this together. We are at a very critical phase of the pandemic on our continent as it gathers pace. And it's no longer a question of whether Africa will be spared of this pandemic. We are right in the middle of the storm, and we have to fight that collectively. And I'm sure that we have no choice than to win this battle against COVID-19. I thank you for your attention.
Thank you. Before we wrap up, I really do want to hear from Her Excellency, the First Lady of Namibia, Monica Gengos. She has a brief intervention before we proceed.
I think the fantastic part of speaking almost last is that I can really just agree with what everybody has said. All of my sisters, the First Ladies, as well as the other speakers, particularly the last two speakers, when it comes to community engagement. What our office has done has basically become a community organization, and we've been on the ground. We've been assisting everywhere we can. We're working with other NGOs in the country because we have a common interest. And it's a reminder, particularly for us who operate in such complicated offices, that this is the moment to remember that the work that we do, regardless of what it is, must be apolitical, it must be community focused, and it must be about bringing people together for the same cause. I just want to quickly highlight 2 or 3 things that have been highlighted, but which maybe need some amplification. And that is, those who were already vulnerable before COVID struck us have become more vulnerable. And there are many who weren't vulnerable who are starting to slip into that category. And what we shouldn't forget is communities who we generally don't think of, like those who are incarcerated, like the mental health of healthcare workers. We, for instance, dealing with a lot of students who've been displaced because where they study and where they live are 2 different places, and they're locked in small towns where they stay. They don't want to collect the ARVs in these small towns because they understand the problems around confidentiality. So it's not the lack of availability of HIV medication, it's their fears around confidentiality. And if it's one thing COVID has shown us, is that when we feel that we are all at risk, we do come together, we see the necessary political will. In our country, for instance, we're seeing people really adhering to regulations around wearing masks. And we need to maintain that momentum and ensure that we fix these gaps in the system that we see from a healthcare perspective, from a criminal justice perspective, but also from our mindsets. There are many problematic mindsets, and I know that The African CDC is talking a lot about misinformation, for instance, and how it undermines very important messaging around how to protect ourselves and others against COVID. But it's a manifestation of a deeper problem of how easily it is to spread fake news into our societies, and the importance of those who have platforms to utilize them to negate that negative information that creates destructive mindsets. And then just a quick last point is that, and we've seen it in those who had COVID first, is that there's a COVID fatigue that develops, and we start rolling back the progress that we've made in terms of how we've changed, how we do things. And this fatigue is not specific to COVID. I think every epidemic or pandemic that we've dealt with, we've seen this fatigue. We've seen the HIV fatigue. Here we've got a hepatitis E outbreak. We've seen the fatigue around that. And what we don't want is that we become fatigued, that we become fatigued in terms of compassion, fatigued in terms of understanding that we do need to accelerate our fights, not only around COVID, but around the fight against HIV, around the fight against hepatitis E, whatever epidemic your respective countries are dealing with. So I'd just like to thank all of the speakers. I think we're all dealing with the same issues. And to remind each other that as gloomy as the world looks at the moment, it's important for all of us to speak hope into people. The strengthening of systems, institutions also needs the strengthening of people and the resilience of people, because at the end of the day, it's people, healthcare workers, police officers who are facing the brunt of the risks. And the minute we start speaking as if we are panicked and scared and gloomy, they internalize that, and it affects the ability to provide services. And that's one thing we also very involved in doing, and it's giving psychosocial support to police officers. We recently had a brutal rape case where a very experienced police officer broke down, and they've been dealing with this for over 25 years. And you can only assume it's all the other stress that these people are dealing with that are making them break down in these moments, where what they're dealing with isn't new, but I think the additional pressures are very new. So I wish to wish hope and strength into each of you as we all grapple with this new world that we live in, and with the reminder that pandemics are recurrent. They will come back, and I hope the next time a pandemic hits us, we are better prepared to deal with all of its manifestations. Thank you very much.
Thank you very much. Important, encouraging word to make sure that we are also staying resilient and taking care of each other. So I want to close out by saying that OAFLAD will be emailing you more details about future webinars, just the beginning, and as well providing more information on these proceedings over the next few weeks. I would like to call back our First Lady, Her Excellency the First Lady of Zimbabwe, to close us out with important closing remarks.
For such an indulgence in terms of our COVID-19, which has befallen in our countries. Let me say what an honor and a privilege it was for me to have chaired this very first OAFLAD webinar. I wish to thank each and every one of you for your participation and contributions during this webinar. Special thanks to Her Excellencies, the First Ladies, for making time to be part of this webinar series. I'm aware how busy we are all, especially in these trying times of the COVID-19 pandemic. I wish to thank the OAFLAD Secretariat, who have worked so hard to make this webinar a success. And thank you to Natalie Myampenda, our moderator for this session, for ably steering us through the agenda for today. We thank all of our valuable funding partners and members of the UN family for supporting the work we do as OAFLAD. Together, we have achieved a great deal today by sharing our experiences as we fight the COVID-19 pandemic on the continent. Our communities have experienced immense challenges because of this disease, especially the marginalized and the vulnerable. We have heard from each of the First Ladies on the panel how they have addressed the challenges being experienced in their respective countries. These challenges resonate with each one of us in this room, from the impact of COVID-19 on our already challenged health systems, to issues of sexual and gender-based violence, to the disruption of provision of essential health services for women and children, and for HIV, TB, and malaria, to the socioeconomic inequalities that have been worsened by the pandemic, and how school-going children have had their education disrupted as well. Together, we've been able to discuss how COVID-19 has negatively impacted on our targets towards universal health coverage. I know we have all benefited from the insights that have been shared today, and each one of us will go away energized to do more to tackle this COVID-19 pandemic. Allow me to appreciate the collaboration with the Global Fund to fight AIDS, TB, and malaria that has made this webinar possible. Many thanks to all the presenters, to our partners, and to the UN agencies, including the World Health Organization, as they lead the global response to COVID-19. We would have enjoyed meeting each other in an in-person meeting, but you will agree this online session worked out well for us. With the COVID-19 pandemic still upon us, this may well be our new normal for some time to come. Dear my sisters and fellow First Ladies, and all participants on the call, many thanks for having me as your chair for this webinar. We have come to the end of our session for today. Goodbye for now. Thank you.
Thank you to her First Lady of Zimbabwe, and thank you to everyone. We'll see you at the next webinar.